Technical Veterinary Learning TVL channel. Founded and produced by Professor P.A.M.Elsherif, Professor of Epidemiology and Infectious Diseases, the ex-head of Department of Veterinary Medicine, the ex-vice dean of Faculty of Veterinary Medicine, Ben Suef University, Egypt. We will speak today about the second part of IBR, or Infectious Bovine Rhinotrachitis Disease. In this second part, we will be speaking about pathogenesis of the disease, its clinical signs, and the post-mortem examination. Pathogenesis of IBR. This diagram explains the lytic reproduction cycle of any herpes viruses. One of them is the bovine herpes virus 1. Number 1, entry of the virus from outside by different sources of transmission through the cell, and then transfer of the capsid into the nucleus. Number 3, the viral DNA replication inside the nucleus. And then number 4, capsid assembly and formation. And then 5, exit from the nucleus as a new line of the virus. Number 6 is the maturation and encapsulation of the new virus inside the cell. And then number 7, the exogenous, by means that coming out from the infected cell to infect another cells. This diagram showing the classical formation of any virus. All the viruses, including the alpha herpes viruses, encode anti-apoptic virulence factor to avoid their elimination and apoptosis and ensure virus replication and spread. This helps their continuous in the nature. Bovine herpes virus 1 enter through respiratory tract or genital tracts with multiplication in the nasal cavities, epithelial cells of upper airways, ovaries, oviduct, uterus, and contaminated semen through use of live breeding or artificial insemination. During the incubation period that reach 2 to 6 days, this will lead to occurrence of IBR or infectious bovine rhinotrachitis, IBP, infectious pustular vulvovaginitis, and infectious plastopanopathitis syndromes. Once animal become infected, it is hard for the animal to get rid of this virus because it has many mechanisms to evade the host's immune system involved in both innate immunity and adaptive one. Bovine herpes virus 1 degrades interferon regulatory factor 3 or IRF3. It effectively halting transcription of interferon type 1, IRF1. Interferons are a component of innate immunity involved to inhibiting the viral replication in the host cell, as well as activating immune cells. Bovine herpes virus 1 is also able to evade adaptive immune cell by inducing apoptosis in the cellular death or CD4+, which assist in activating T cells when antigen are present. This well down regulates the number of immune cells that recognize the virus, allowing BO HV1 virus to evade detection and elimination and propagation inside the animal cells. Clinical signs of infectious bovine rhinotrachitis. This diagram is a collective diagram for all clinical signs of infectious bovine rhinotrachitis. Respiratory and reproductive forms occur post-acute infection by the virus. Then, after the occurrence of both forms, infectious bovine rhinotrachitis virus, which is called as bovine herpes virus 1 by the three subtypes 1.1, 1.2, and 1.3, will be shedded for 2 to 20 days. In the reproductive forms, there are early embryonic deaths will be noted between 2 weeks and 2 months. From the acute infection up to these forms, latency and reactivation along the lifetime of all infected animals. Infection by infectious bovine rhinotrachitis virus can occur in cattle at any age, but it most seen between the ages of 6 and up to 18 months. There are 8 forms of clinical signs. The first one is the respiratory form. It is characterized by fever with anorexia of food, recumbency, then coughing, respiratory distress. There are clear to purulent nasal discharge according to secondary bacterial infection, and then ocular discharge will be reported. Erythema of the nasal mucosa from outside up to inside. Nasal lesions consists of numerous clusters of grayish necrotic foci on the mucous membrane of the septa and will be visible inside and the external as well as external area of the nares. Recovery will be occur 4 to 5 days without secondary bacterial infection, but if secondary bacterial infection reported, there are long time of infection and long time of respiratory form will be noted. This figure explains the respiratory distress in a cattle infected with infectious bovine rhinotrachitis. This cattle showed extended heads here and then protruded of its tongue with exaggerated moist cough. Nasal lesions consists of numerous clusters of erythema, grayish and necrotic areas on the mucous membrane of the nares, septum nasi, and septal mucosa. Nasal lesions consists of numerous clusters of erythema, grayish nasal foci appear here, visible inside the external nares of infected animal with bovine herpes virus in the form of respiratory 1. An infected animal showing mucoid nasal discharge due to infection with infectious bovine rhinotrachitis. A calf with IBR form showing mucopurulent nasal discharge. Another calf infected with infectious bovine rhinotrachitis showing mucopurulent nasal discharge. An infected cattle with infectious bovine rhinotrachitis showing mucopurulent nasal discharge from the both nares. An infected bull with infectious bovine rhinotrachitis show both forms. Number 1, respiratory form of infectious bovine rhinotrachitis that characterized by purulent nasal discharge, and ocular form that characterized by eye opacity, as shown here. The second form of infectious bovine rhinotrachitis is the ocular form, that characterized by conjunctivitis with corneal opacity that may occur at the only manifestation of bovine herpesvirus 1 infection. Ocular form of the infectious bovine rhinotrachitis were showing conjunctivitis with clear redness of the third eyelid as well as the other conjunctival sclera of the animal. Ocular form of infectious bovine rhinotrachitis showing hyperemia and corneal opacity at the periphery of the cornea, corneal edema, conjunctivitis can be present, as appear in this clear figure. Another picture of an infected cattle with ocular form of infectious bovine rhinotrachitis, where hyperemia and corneal opacity at the periphery of the cornea, corneal edema, and conjunctivitis. The third form of infectious bovine rhinotrachitis is occurrence of mastitis, that characterized by sharp drop in production of milk that lasts for 10 to 15 days. This usually in combination with ocular or slight respiratory form, and it may precede the reproductive form by several weeks. The fourth form in infection with bovine herpes virus 1 is the reproductive form that caused by subtype 1.3 of bovine herpes virus 1, characterized by low reproductive incidence on the farms infected with this virus. Animals in these farms will show low fertility rate, endometritis, and irregular return to estrus. Abortive form is the fifth form of infection by bovine herpes virus 1.3 subtype, characterized by miscarriage at 6 and 8 months of gestation period as well as stillbirths. Abortions may occur consequently with respiratory disease, but may be seen up to 100 days post-infection, which is due to reactivation of the virus during its latency. They can occur regardless of the severity of the disease in the dam. Abortions generally occur during the second half of pregnancy at 6 to 8 months, but early embryonic death is also possible. A figure showing vaginitis in a cattle infected with bovine herpes virus subtype 1.3. Venereal form of infection with bovine herpes virus 1, characterized by pustules in the vaginal and vulva mucosa, clear to purulent discharge from the vagina. Pools may be present pustules on the penis and the prepuce, planopocytis, painful urination in both male and female animal infected with this form. A figure of a penis of pools infected with bovine herpes virus 1.3 subtype, showing planopocytis picture. Seventh form of IBR infection is the generalized form that reported in newborn calves. Newborn calves suffered from severe pyrexia, ocular and nasal discharges, necrosis of the nasal and respiratory mucosa, enteritis, incoordination in movement, eventually convulsion, deaths may be occur at a short period. The nervous form associated with IBR infection, the animal characterized by younger occurrence of this form in animals less than 6 months of age. These will suffering from incoordination, excitation, prostration, and strange behaviors. This form usually ended by death. Post-mortem signs that noted in animals death from infection with bovine herpes virus 1, either subtypes 1.1, 1.2, and or 1.3. Mild cases reveals swelling and congested mucosa with catarrhal exudates. IBR severe cases showing profuse, fibrinous, purulent exudates which cover the intact mucosa with some necrotic foci. In most cases of pneumonia, there are areas of collapse, erythema at the apical lobe and to less extent in the cardiac loops with little involvement to diaphragmatic lobe of the lung. A figure showing pneumonic lungs with red hepatization at the apical lobe of the lung. A figure showing pneumonic lungs with red hepatization at diaphragmatic loops due to infection with infectious bovine herpes virus subtype 1.1. In uncomplicated IBR infections, most lesions are restricted to the upper respiratory tract and the trachea. Petechial to ecchymotic hemorrhages may be found in the mucous membranes of the nasal cavity and the paranasal sinuses. Focal areas of necrosis develop in the nose, pharynx, larynx, and the trachea. The lesions may coalesce to form plaques. Late stages of pneumonia characterized by presence of dark red consolidation with little or no fluid present in the lungs. Pleural surface usually shown inflammatory reaction. The sinuses are often filled with acerus or serofibrinous secretions. Necropsy findings of severe tracheitis in beef steer that has died from IBR. As the disease progresses, the pharynx becomes covered with serofibrinous exudate and the blood-tinged fluid may be found in the trachea. The pharyngeal and pulmonary lymph nodes may be actually swollen and hemorrhagic. Tracheitis may extend into the bronchi and bronchioles. When this occurs, epithelium is sloughed in the airways. Severe infection with IBR respiratory form showing severe tracheitis and blood discharge in the trachea with distributed pneumonia in apical, middle, and diaphragmatic lobe of the lung as appear in this picture. The viral lesions are often masked by secondary bacterial infections. In young animals with generalized bovine herpes virus 1 infection, erosions and ulcers overlaid with debris may be found in the nose, esophagus, and forostomach. In addition, wild foci may be found in the liver, kidney, spleen, and lymph nodes with ecchymotic lesions. Classic form of IBR lesions. Tracheitis characterized by severe inflammation and ulceration, necrosis and adherent fibrinonecrotic exudates at the diaphragmatic membrane appears that can extend it into the lower airways as appear here in this figure with concurrent sloughing of the tracheal epithelia. Keep following up for all updated facts and information about all animals' infectious diseases on this scientific channel. The third part of infectious bovine rhinotrachitis disease will be followed up soon.